Oh, what's the matter?
She has horrible stomach cramps and blood in her stool.
Let's get her in right away. Please follow me. I am Dr. Pizzulli. What is your name?
Sally Romano Cortex.
Your mother is saying you are having sharp pain in your stomach. What's your level of physical activity?
I'm pretty active. I mean, not as active as I should be, though.
What other symptoms do you have, Sally?
Besides for stomach pain and bloody poop, I've had a fever.
Do you smoke or do drugs? Are you sexually active?
No, and no.
She would never.
Mrs. Romano Cortex, would it be okay if I talk to Sally alone?
Absolutely.
Sally, listen. I need to know if you do drugs or are sexually active.
Well, I've tried pot. It was nasty, but I haven't been sexually active.
Okay, then it can't be HIV. Let me ask Dr. House what I should do. House, there's a new girl in room 211 with symptoms that keep contradicting each other. What should I do?
What are her symptoms?
Bloody stool, fever, and severe cramps. What if it's a viral intestinal infection or appendicitis?
Well, what did her blood test show?
I haven't done one yet, House. I was waiting to see what you thought.
You know, for a second there, I thought you were smart. I'll do the blood test myself. Hi, Sally. I'm Dr. Gregory House. I'm gonna run a quick blood test.
Okay, sounds good. But quick, please. It really hurts.
Hi, Sally. I have some news.
What's the matter, Doc?
The bacterium H. pylori was found in small amounts in your blood. This probably means you have a stomach ulcer. I'm going to come back with Dr. Pizzulli to prescribe you some medication for it.
Okay, thanks, House.
Here's a 5-week prescription of Pepsid. Although most ulcers heal within 4 weeks, it may take up to 8 weeks before your ulcer heals.
When on the pills, you may have headache, dizziness, or constipation.
Okay, thanks, Doc.
It's my job.
I really don't feel good today, Mom. I'm not hungry either.
Is it the same pain as the ulcer?
Yes, but different.
How?
It's the same, but it's worse. I haven't been hungry. I'm sore all over.
I'll call Dr. House.
Dr. House.
House, this is Mrs. Romano Cortex. My daughter, she's in a lot of pain. She says she's sore everywhere and hasn't been hungry lately.
Let me talk to Sally myself and see what I think is going on.
Okay, I'll get her.
Hi, Sally. What's going on?
Hi, House. My cramping hasn't gone away. Also, there's been even more blood in my soup, and my fever has gone up.
That doesn't sound too good. Anything else I should know about?
I haven't been hungry at all.
Why don't you come in about an hour or so? I'll talk to Dr. Pizzulli now to see what he thinks.
Okay, thanks, House.
Hey, House, what's up?
We have to talk about that thing we diagnosed with a stomach ulcer.
What's that thing?
Sally Romano Cortex.
Why? What's wrong? Have her symptoms gotten worse?
Yes, and she hasn't been hungry lately. Her cramps are horrible.
Well, it seems like she's acute appendicitis. Is the pain on her right side?
She's coming in soon. I'll ask then.
All right.
Help! I've fallen and I can't get up. Help! Please! Someone help me!
When you fall and cannot get up, an accident can turn into a tragedy. With Life Alert, one touch of a button can get you help fast.
This is Life Alert. Are you okay? I'm calling for help right now.
Life Alert saves a life from a catastrophe every 10 minutes.
Thanks to Life Alert, I can have peace of mind and maintain my independence.
Finally, you're here. Please follow me into the room. How are you feeling, Sally? You can take a seat.
Horrible.
Alright, well, I'll be right back with Dr. House.
Hi, Sally. How are you?
Not good.
So, Sally, I was wondering, what side is your pain on in your stomach?
Kind of everywhere.
I'm thinking you may have acute appendicitis, not a stomach ulcer. Appendicitis usually hurts more in your lower right side, but it may hurt everywhere because the pain is radiating to your other side also.
Is that serious?
My baby.
We may have to remove your appendix, which is not that major. We do it all the time. Let me take you to get a CT scan to make sure that this is what is causing the pain.
What's a CT scan?
Is that expensive?
CT scans, or CAT scans, are special X-ray tests that produce cross-sectional images of the body using X-rays and a computer. We do them all the time, and there's nothing to worry about at all. Don't worry, Mrs. Romano-Cortex. Most insurance plans cover these costs.
When will this be taking place?
Let me go check with our radiation unit. I'll be right back.
Thanks, House.
Hi, Sally. Mark's ready to do your CAT scan. Please come with me.
Hi, Nick. Did the results from Sally's CAT scan come back yet?
Yeah, let's have a look.
Okay, so over here is the appendix. It doesn't look inflamed at all.
Well, I guess appendicitis is off the list. What are we going to do, House?
Wait, look over here at the intestines. Is it supposed to look like that?
It looks peculiar. I'll look up some common diseases that infect the intestines and we can work from there.
Sounds good. Bring the list to me as soon as possible.
Alright. Hi, House. I've narrowed down my list to the top 3 choices that could affect someone, such as Sally Romano-Cortex. They are celiac disease, Crohn's disease, and irritable bowel syndrome.
Why don't we talk to the family about Crohn's? The most common symptoms are bloody stool, fever, abdominal cramps, and ulcers. It seems like she has all of these symptoms. Let's ask Mrs. Romano-Cortex if anyone in their family has had Crohn's, because it usually runs in families. Hi, Sally. I believe we finally found out what's wrong with you.
Oh, finally.
What is it?
Let me first ask you, Mrs. Romano-Cortex, is there a history of Crohn's disease in your family?
Yes, I should have known. When my father was diagnosed with it in his mid-40s, he had the same symptoms that my Sally has now.
Ew, I don't want that. He can't eat any good food.
This makes perfect sense. Crohn's disease, or regional enteritis, is a chronic inflammatory disease of the intestines. It can cause ulcers, which is why that is what we originally diagnosed you with. It can also cause your skin to change and turn yellow.
How could I have possibly gotten it?
The exact cause of Crohn's disease is unknown, but researchers believe it may be due to an abnormal response of the immune to an infection or to food and other substances in the GI tract. Crohn's disease may also have a genetic component, and it can run in families. According to your mother, your grandfather had Crohn's.
So what's the cure?
Considering most patients have problems absorbing nutrients due to Crohn's disease, it's important to follow a high-calorie, high-protein diet, even when you don't feel like eating. Alcohol should pretty much be avoided as much as possible.
We will prescribe you with some anti-inflammatory drugs, antibiotics, and we will help you create a diet plan that does not include your trigger foods.
Okay, thank you so much, both of you.
Thank you.
You're so welcome.
You're welcome. Hi, Sally. Lorene's Knock it up. An accident can turn into a tragedy. With Life Alert, one touch of a button can help get you out. Oh my god!
Knock it up. An accident can turn into a tragedy. With Life Alert, one touch of a button can help get you out. Oh my god!
Do you think a little Vito will capture the moment?